Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Hi, I'm Lauren Smith, the Manager of Business Development here at Woman's Hospital and the host of the Unprivate Parts podcast. Cancer treatment can change so much, but one of the least talked about and most personal impacts is how it affects intimacy, sexuality, and how a woman feels in her own body. In today's episode, we're joined by Miss Angela Page, board-certified oncologic physical therapist, and our manager of adult therapy, for an open conversation about sexual wellness during and after cancer. We'll explore how treatments can affect libido and physical comfort, how body image and confidence can shift, and why emotional connection and communication are just as important. Intimacy doesn't disappear just because a cancer diagnosis enters the picture. Angela, thank you for joining us. Would you please just briefly start with how you became a board-certified oncologic physical therapist and what exactly you do?
Yes. So I am first and foremost a physical therapist for 32 years now. And we have always seen the oncology population here at Women's, and originally primarily just as inpatients. We see every patient who has a breast cancer surgery. We see the majority of the gynecological surgery patients in the hospital. And then we started to really look at survivorship. It used to be all the treatment was focused on just cancer and radiation, chemotherapy, surgery. But now, because the treatments have improved so much, patients are living very often normal life expectancies afterwards. As a result, we're now seeing the results of some of the treatments that they went through that we weren't necessarily aware of before. And so there's been a big shift in the focus to address these survivorship issues. So these long lasting side effects of the cancer treatments that patients have gone through. And so when we started getting trained on that as an outpatient therapy department, it just really piqued my interest. I thought it was fascinating because it was a new area for me that I didn't know a lot about. And then we just started seeing these patients, and I thoroughly enjoyed working with these women. They're just a fun group to work with. They're great. They're all different, so it really challenges me as a physical therapist. I also did my certification to become a lymphedema therapist, which is something that we use a lot in the oncology population. And so it kind of went hand in hand. And so once I finished all of that, I decided just to really, really push myself to learn more about this population so that I could really make sure we were offering the best of what we could offer. And I do think that Women's Outpatient Therapy Department has the most expansive cancer rehab program anywhere in the region. And I'm not just saying that because I'm the manager of the department or because I work here. It's true. We offer things that no other hospital offers. We have extensive training. I have a wonderful staff that I'm so grateful to get to manage them. And I don't really even have to manage them that much because they're just good at what they do. And yeah, so that really is what pushed me to do it, is just to really make sure that I was being the best physical therapist that I could possibly be for this patient population, and that I could share my knowledge with my staff, with my patients, and then just really grow the program and make sure that we were offering something to address pretty much every possible survivorship issue that they may face.
Sexual health isn't something most women expect to talk about when they're diagnosed with cancer, yet it's such an important part of overall well being. Why do you think this topic is so often left out of the conversation?
I think sexual health is excluded from a lot of conversations, not just with the cancer population, but with the population in general. It's often considered a taboo topic. And unfortunately, I think that's why it doesn't come up very often. Patients aren't necessarily comfortable addressing it. Physicians don't always bring it up in follow-up visits. And one of the things that we really strive to do is to educate our oncology patients, as well as just general community, on how important it is to discuss, how normal it is to discuss it, and that we want them to be comfortable bringing up their sexual health because you don't know you have a problem unless you really get a chance to talk to somebody about it and find out what's normal and what's not normal.
Can you help us understand how cancer treatments such as chemotherapy, radiation, or even hormone therapy can affect a woman's libido for the physical comfort during intimacy?
Absolutely. Each of those areas can have a different impact on a woman's sexual functioning. Sometimes it may be chemotherapy just leaves them with extreme fatigue or neuropathy. Radiation can cause fatigue, usually short term, but it also can cause some physical changes in terms of tightening of different structures, vaginal tightness, hip tightness. A lot of these interventions, surgery, radiation, can also cause changes to our body image. If a woman has a mastectomy, her body image changes. If a woman has a hysterectomy or another gynecological procedure, that can also impact her body image. So, very often, it's physical side effects as well as what we call psychosocial side effects, which really come into play and they overlap with each other in terms of sexual function.
Beyond the physical effects, there's also fear, anxiety, and even grief around intimacy after cancer. How can women begin to reconnect with themselves emotionally before returning to intimacy with a partner?
I think it's important for women to understand that what they're going through is not unique just to them, that it happens to a lot of women. And I always tell my patients that just because something is common doesn't mean it's normal. So don't just accept it. Ask the tough questions. I think they need to be open with their partners in discussing this because very often it's a body image issue or it's a physical issue that they're not comfortable discussing because again, it's that taboo topic of sex. And sex means different things to different people. When we're talking about sex, most of the time we're thinking about penetrative sex, but that's not necessarily just what we're referring to with this topic. Very often, patients may need to consider alternatives. They may need to try something different. They may need to try something new. And unless they're given the guidance and some education on the topic, they're not aware of that. Sometimes I think we believe it's an all or nothing type of scenario, and that's not the case. I think they need to understand too that it can be reintroduced slowly. Women have to get comfortable with themselves before they can be comfortable with another person.
Absolutely. And it can be hard to explain these changes to a partner or to even feel desirable again. What advice would you give couples about that first step and maybe just talking openly and honestly about intimacy during or after treatment?
I think they just need to be honest with each other. And I think that sometimes it's helpful if both partners are in the conversation with the healthcare provider, if the patient is comfortable with that, and they're not always. I think they need to be um, willing to discuss it. I think they need to be willing to seek mental health care if that comes into play, because often that is, an important component of this intervention. I think they need to be upfront about what is it that is concerning them, what is it that's uncomfortable to them, what are the expectations. I think sometimes people don't realize that this can have a long-term impact. Going through cancer treatment can impact a person for the rest of their lives, and they may need to figure out what is their new norm. But I think it's important that if someone has a sexual partner, that they need to be upfront with that person and they need to decide what is the new norm together. Because if one person has one idea of what's normal and the partner is on a completely different page, then it's just gonna lead to a lot of frustration, and I think often failure with the attempts to return to sexual activity.
And sometimes I imagine it might be easier to hear from someone else if you don't have the confidence, if it's been a while to
Yeah, absolutely.
bring up maybe something new to your partner.
And I think it's important too. Women's has various support group meetings, and I think it's just invaluable for women to attend those support group meetings. But I also think it's important for partners to attend meetings because, again, I think that's when you realize that you're not alone in this journey and that there is help out there because a lot of people don't realize that there are things that can be done to improve their sexual health, to reduce their discomfort, and that there's a team of people that are here and ready and very much wanting to help these women.
At what point should a woman consider seeing a sexual health specialist? And what kind of sexual health specialists are out there?
I think that a woman could benefit from seeking out the help of a sexual health specialist at any time during their survivorship journey. In particular, mental health professionals, which would be either couples therapists, or there are a handful of mental health providers that specialize in sex therapy, would be more if a physical issue has already been ruled out or addressed. Sometimes the discomfort or the issues that a woman is facing are more from musculoskeletal changes or physical changes as a result of their cancer treatments. So, to give an example, a woman who has pelvic radiation may be suffering with something called vaginal stenosis, which is a narrowing of the vaginal opening as a result of the radiation treatments. That's a more of a physical barrier that needs to be addressed. That's where physical therapy comes into play. Seeing a pelvic health therapist can help tremendously with those areas. Sometimes it's a result of surgery or some of their treatments causing pelvic floor weakness. And so it's a loss of muscle tone, or it could be the opposite. It could be too much muscle tone as a result of a surgery. And that's where a pelvic health physical therapist comes into play, because we can address those issues with the patient, teach them to relax the muscles of their pelvic floor, teach them how to stretch their hips, how to use vaginal dilators to minimize the stenosis that they may be experiencing, work on scar mobilization. For women that have had breast cancer surgery, sometimes they don't want to engage in sexual activity because of those body image issues related to some of the scars that they're left with. We do a lot of scar work in our therapy department. So I think once those issues have either been addressed or ruled out as a problem, that's when I believe it's more appropriate to see a mental health specialist. But I think at any point, it's beneficial for a woman who is going through her cancer journey to seek out the help of either a social worker or a licensed professional counselor to help them deal with some of these issues. Because sometimes I think, getting ahead of it is most important. I tend to kind of live by the mantra of be proactive, not reactive. And so I really think that sometimes just knowing what might I experience, what might I expect, and I think also just having these open conversations, because I see so many women who had no idea that sexual dysfunction could be a part of their long-term survivorship now. Women with breast cancer who have hormone-positive breast cancer that are placed on certain long-term medications called aromatase inhibitors basically can, be thrown back into menopause type scenario, and they experience vaginal dryness, tissue thinning, all of that. And so those issues need to be addressed. It's educating women on the use of moisturizers, lubricants, educating them on what happens when I've gone through cancer treatment. Why don't I enjoy sex as much anymore? And it's often because the treatments that a woman goes through cause a change in the sexual response cycle, basically, is how we explain it to them, which means that it takes longer to achieve an orgasm, and typically the orgasm is going to be less intense.
And you were talking about these physical effects. I'm just curious, when you said the opposite of stenosis was muscle buildup?
No, with stenosis literally means it's a narrowing. And so what happens?
But what was the other one you said it was?
Oh, there's low people they have pelvic floor weakness, and then we have people that have the opposite, which is they have increased muscle tone. So they're high tone. And so we treat a lot of patients who deal with issues like, if they've gone through gynecological surgeries and stuff, they might be dealing with urinary incontinence, things of that nature, or surgery, and then they ended up long-term down the road having like a prolapse, which is where some of your pelvic organs kind of descend a little bit, your bladder drops a little bit. And so as a result of that, we try to build the strength on those people. But if someone comes in and it's more like they're having pain with sex and it's because their tone is too tight, which is sometimes the result of a treatment, sometimes it's the result of the patient just being fearful that it's going to hurt, and so they go into a protective mode. And so we have to train those people how to relax the muscles. So very often people think, oh, okay, I just need to Kegel, Kegel, Kegel. And sometimes Kegel, Kegel, Kegel is the right answer, but not in those patients. And so we want to educate them that the Kegel is not the thing for everybody. So watch what be careful what you're watching on YouTube and what videos you're following. And often people who do need to Kegel, even those patients, yes, it's the appropriate thing to do, but they're not doing them correctly. So, we assess all of that so that we can make sure that what you're doing is what you need to be doing, and that when you're doing it correctly.
I know all of the listeners are giggling as
That's
we
right.
speak.
You just can't help but giggle when you say it.
Can't help it. You said many women experience pain, dryness, and other changes that make sex uncomfortable or even impossible.
We talk about moisturizers and lubricants, and I know there's a big question about like hormone replacement therapy and topical hormone creams and things of that nature. Obviously, for a lot of our oncology patients, if they had like a hormone positive type cancer, whether it's a breast cancer or a GYN cancer, then hormone replacement therapy is not going to be appropriate for them. And that's a conversation that they'll have with their medical provider, with their physicians. But moisturizers and lubricants really are safe and appropriate for everybody. Hormone-based topical creams, that's still kind of up in the air. Usually physicians will recommend that you start with just regular moisturizers and lubricants. And it's important for patients to understand the difference. Lubricants are what you're going to use in the moment when you know that you're planning to have penetrative sex, whereas a moisturizer is something that you use more to achieve longer lasting vaginal moisture. And so sometimes the hormone creams do come into play as well with some of these patients, but that's a conversation to have with their medical provider to see who is appropriate. And typically they want you to try just the moisturizers and lubricants first before you move into that. Also, I'll always encourage my patients, we put lotion on our elbows and we put lotions on our knees every day, but we don't put lotion on our vulva. And so there are vulvar lotions and creams that just help to just maintain tissue health, maintain tissue pliability, which is, just the ability for everything down there not to get stuck together, which is kind of what happens when we lose our hormones or when we've gone through certain treatments. And so it's important to, don't disregard moisturizing everywhere.
Where do you get these? Is this over the counter or is this a prescribed?
No, those are over the counter. Vulvar creams, if they honestly just Google vulvar creams, you can go to Amazon and look up vulvar creams, and there are a host of them. We always recommend that people stay away from things that have, I'm going to say, unusual ingredients, nothing that is scented, nothing that is meant to be hot and spicy. And I say that because it doesn't match the pH of our vulva. And so I always tell people, we want to maintain the flora and the fauna that we have going down there. And so sometimes if we get carried away with things that we apply as moisturizers and lubricants, we can cause some tissue irritation. And so it's always best to start with the most basic products and then kind of go from there.
And what about the difference between oil-based or water-based? Is that
good
or bad?
So silicone-based, you don't want to use those if you're using certain tools. So you don't want to use a silicone-based lubricant if you're using like a silicone dilator or a silicone vibrator. You want to use water-based. Water-based is a little bit shorter acting, but it is cleaner. So it's easier to get off of you afterwards. It's less inclined to stain your sheets. So that's just something to think about.
Thank you for people like you. And when you look at your elbows, also look at your vulva, ladies.
And we do encourage that too, because if you don't know what it looks like, you don't know what it's supposed to look like. So check it regularly.
Very true. Let's go back to cancer can completely change how a woman will view her own body. And you said working with the scar patients. How do you help patients rebuild their confidence and rediscover their pleasure with those changes that they feel about themselves?
I think that's one of the toughest areas. I think when we can reduce the look of a scar, improve the mobility of the scar, and decrease the pain of that area, it often kind of takes their focus away from that. I think some of our patients come to us and, everything has been about their cancer, and now they've had the surgery, cancer's been removed, but now everything is still about what's left. That scar is what's left. And so I think they become very, very focused on that. And so I think it's helping them understand that they're going to have that scar, but that scar doesn't define them. And when we can reduce the symptoms around that, I think it can definitely help to reset, their mindset and reset their focus. And then kind of we help a lot of our patients get back into normal functioning, maximizing their activity after they've gone through their cancer journey. And so very often when we can get them back to work, get them back to exercising, get them back to gardening, and it's like, okay, I can do all of these things that I did beforehand. So, maybe sex isn't off the table. And I think when they build that confidence, I think that's going to help them with their body image, and it's going to help to boost them to that point where they do feel more comfortable to pursue sexual activity.
How would you address low libido with your patients and how to regain that spark?
Issues with libido are challenging because it can often be the result of some of the hormonal changes that these women are going to go through. And unfortunately, because um, hormone replacement therapy is off the table for a lot of them, I think it becomes something that often can be addressed by a mental health professional, in particular a sex therapist. And I think it's a matter of finding new ways to excite yourself. Just a simple touch may not get the juices flowing, basically. It may not wind you up as much. So it may be now you just have to figure out what does. And that's where I was talking about using tools sometimes is what it takes to kind of really stimulate that person. And sometimes it's also it can be a matter of taking a more practical approach and scheduling sexual activity. Saying, okay, I'm going to make a point of, I don't know, early on, maybe once a month, we're going to take the time to be intimate with each other. And I think when you see that you can do that and you don't have a negative impact from it and it's not so uncomfortable, I think that can help then kind of get the excitement back into it. And I think it might be finding other things that you can do with your partner that you also find intimate and exciting. It doesn't just have to be about sexual intercourse. It can be other things that can kind of spark that interest. It's tough. Addressing low libido is very challenging, but I definitely think that being open to discussing it with the partner, discussing it with the healthcare provider, the mental health professional. As a physical therapist, libido is not really something that we can address beyond just making sure that whatever form of sex someone wants to engage in is as comfortable and as enjoyable as we can help them to make it. But the libido part, that's the toughest part. I would have to say that's a hard one.
Yeah, because you're almost recreating a new couple or what excites you based on.
And I think it does help though to look at it as finding something new that excites you. It may not be what worked pre-cancer. It may be that now you find something else that excites you. And once you can find that in common with something, with somebody, I think that's a starting point.
Are there any common myths about sex after cancer that you wish more patients understood, especially for those newly diagnosed or in recovery?
I have never had a patient that I can recall who came to me with a belief about resuming sex after cancer. What I have had more of is people that had no clue of the impact that cancer has on their sex life. It's more that I don't think there's myths because I don't think people think about what it may do to their sex life.
You're just thinking about, let me address my treatment, get through cancer, and that's probably a surprise to them. For women who feel like they've lost that part of themselves, what would you say to remind them that intimacy and joy are still possible?
I don't tell my patients to be grateful you're still alive, look at where you're at, because I think that is the wrong approach for this population. I think it invalidates their feelings and undermines the journey that they just went through. But what I tell them is that they're going to find their new norm, and their new norm can be filled with so much potential and so much happiness. And they just need to be open to it. They need to be open to it and understand that they may never be back to where they were pre-cancer, but that doesn't mean that they don't have a very full life ahead of them.
If someone is going to therapy with you, how frequently are they coming to see you?
Typically, for most patients that we are seeing for sexual dysfunction or a pelvic health problem, we usually only see those patients once a week. It's not like if you tore your ACL and you have to go to therapy 3 times a week. And I want people to know that because that's often a deterrent to them even coming for that initial visit because they are suffering with extreme appointment fatigue. Cancer Journey has a lot of appointments, a lot of doctor's visits. And so sometimes they don't want to even look into physical therapy because they just assume it's going to be a lot more visits. It's usually once a week, and the duration of that really varies on what we find on our initial assessment. Typically, for patients that we're seeing for a sexual health problem, there's a lot of things they can do at home. And so once we kind of get them started and see them for a few visits, then we give them a lot of homework. We have them work on it. We might have them come back a few weeks later. We check them again, see how they're doing. Maybe come back again in a few weeks and we'll check them again and progress them. And it really varies patient by patient, but it's typically no more than once a week unless they're having a significant problem. And I would say most of our patients that are dealing with a sexual health or a pelvic floor problem will see improvement within the first month of starting their therapy interventions. And usually after 2 to 3 months, we kind of cut them loose and let them manage it on their own if they feel comfortable with that. So this is not like a year-long process typically, unless they're having some very, very serious issues. And we try to be very mindful of not consuming so much of their time and trying to help them get back to, living their life.
For therapy patients, are they coming to see you at the Women's Center for Wellness or the hospital? I know y'all are all over the place. So tell
Our outpatient therapy visits are all held at the Women's Center for Wellness. We have several therapists that are all trained in treating pelvic health issues as well as oncology related issues. So we really work cohesively as a team so that if one therapist identifies something on a patient, sometimes we refer to another therapist in house if we feel like it's out of our wheelhouse. But we work very much as a team to really maximize what we can give our patients.
what's been the most rewarding experience for you working with your oncology patients?
Oh my gosh, I love working with my oncology patients. It's why I sought out my board certification at a very old age for me, old age. Um, I just love them. They're all different. They're all unique. They come with their own story. I love watching their journey. I love seeing their progress. I mean, they come in very often feeling so beat down and so debilitated and tired. And in just a few sessions, we can get them to where they feel like they're getting back to their normal life. I mean, I get so many patients that walk in the door for a visit, and they'll tell me that they almost canceled because they were so tired and they just didn't feel good. And then we see them for their 45-minute session at the end. They look at me and they say, "I'm so glad I came today because I feel so much better." And that makes it worth it. Even if they don't remember my name 6 months later, I don't care. I just love knowing that we got our patients back out there living again.
And you restore their joy. That's so amazing. Thank you for what you do. Thank you, for Angela, for joining us today to normalize discussing how to navigate and communicate about one's sexual health during their cancer journey. While sexual health in general can be an uncomfortable topic, it can even be more so when you're not feeling quite yourself in your own body. To our listeners, you are not alone. Our team at Women's Hospital is here to help you navigate these difficult discussions and feel more like yourself.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.